It gives me great pleasure to introduce the President and the CEO of the Chicago Community Trust, Helene Gayle. The Community Trust is one of the nation's community foundations. The Trust works with donors, nonprofits, community leaders, and residents to lead and inspire philanthropic efforts that improve the quality of life for the residents of the Chicago region. Prior to joining the Trust, Dr. Gayle was the inaugural CEO of the McKinsey Social Initiative, a not-for-profit that brings together a wide variety of resources, human and otherwise, and designs programs dedicated to increase youth employment in India, Kenya, Mexico, Spain, and of course the United States. From 2006 to 2015, Dr. Gayle was president and CEO of CARE USA, a leading international humanitarian organization with approximately a staff of 10,000, whose poverty-fighting programs reach over 97 million people in 87 countries. She also had spent 20 years with the Center for Disease Control, focused primarily on combating HIV/AIDS. She achieved the rank of Rear Admiral and Assistant Surgeon General in the U.S. Public Health Service. Dr. Gayle has been named one of Forbes's 100 most powerful women. The other 200 are out here. Foreign Policy Magazine's Top 100 Global Thinkers, and Newsweek's Top 10 Women in Leadership. Let's all give Dr. Gayle a warm City Club welcome. Now, Dr. Gayle will be engaging in a conversation with an individual that many of us are familiar with, Judy Hsu, who anchors the 11 a.m. and the 4 p.m. newscasts for AB7 in Chicago. I have to say this, Judy, the most watched news station in this market.
Yes. We didn't script that for you, did we?
No, you didn't. Judy's had the experience of being a part of just about every major story in Chicago. She's known for scoops. She had the last interview with then Chicago Police Superintendent Gary McCarthy. She also scored the first TV interview with the First Lady of Illinois currently, Diana Rauner. And while she was working in California, she covered the O.J. Simpson verdict live from the LA courthouse. Judy is a graduate of the University of Illinois. She was born in Taipei, Taiwan. She speaks fluent Mandarin. For those of us who are primarily monolingual, we hope we keep this in English.
Just
because our Mandarin is very limited. She has a BA in broadcast journalism from the University of Illinois at Urbana-Champaign, and began her broadcasting career at the campus radio station WPGU, but we just called it PGU. I think it reached the dorms, not
PGU.
much beyond
Yep,
that.
That's it.
She interned with the legendary Walter Jacobson, and she's with us today to engage in a conversation with Dr. Gayle. Thank both of you.
Thank you, Ed. Thank you. Thank you very much. There was only one thing Ed left out of my introduction, which is, for those of you who are longtime ABC7 watchers, I was also the news anchor who had the baby on the expressway. That was so I don't just cover breaking news. I didn't even tell Dr. Gayle that. Yes, you know, I made breaking news that morning. It was 4 o'clock in the morning on the way to. Anyway, never made it. So that's me. It's lovely to be. It's lovely to be with all of you today, and great to be on stage with Dr. Gayle. Dr. Gayle and I actually had a long format sit-down interview soon after she came to Chicago to head the Chicago Community Trust. So it's great to learn about her passion, and I'm so excited to share what you had to offer to everybody here today. But I think the biggest question that may be on everybody's mind is, given our beautiful day here, how is your first winter here in Chicago?
Well, actually, this has been a pretty mild winter. You know, and when I first said I was moving to Chicago, all of my friends were laughing. I lived in Washington, D.C. for a long time. I lived in Atlanta for many, many years. And everybody was laughing about me moving to Chicago. I've always said, I'm from Buffalo, New York originally. And I always said, I am never, ever going back to cold climate again. And my husband, who's here, who's from Chicago, said he was never going back to cold climate or Chicago again himself. So you never say never. Anyway, best advice I got, buy a warm coat. I did. Live close to your office. I do. And as a result of that, this has been a pretty mild winter. And the other thing is, when I talk to my friends from all around the country, this weather isn't particularly good anywhere. This has not been a good winter. I keep getting stuck every time I go to New York City because of snowstorms. We might want to get into climate change, a whole other issue. But clearly, weather patterns are not what they used to be.
So weather aside, clearly not the biggest draw for people to move to Chicago. What drew you, though, to the Chicago Community Trust? Because as we heard in your background, it's mainly globally focused. For a long time, you traveled the world, and now you're here in Chicago. What drew you to one of the largest and oldest foundations, the second oldest in the country?
Well, I could blame that woman right there, Sheila O'Grady, who headed the search that brought me, and thank you, Sheila. But I guess everybody's life has some sort of arc. And in retrospect, sometimes it seems like it's well planned and makes a lot of sense. But usually it's some mix of opportunity, timeliness, readiness, and some of those sort of things. So, I started my career out as a physician, and I did that because I wanted to have a very practical skill that could make a difference in people's lives. And so I also knew, though, that, and some of this came from my time as a pediatrician, that I continued to see things that made me realize that just focusing on individuals was not really going to make the kind of change that I wanted to make. Because you saw, I'm a pediatrician, I would see children come in and out of the hospital, in and out of emergency room, in and out of clinics. And a lot of times, the factors that led to that were more societal and social factors. And so I really started thinking about, how could I take medicine, the practice of medicine, and take it from an individual level to a population level. That led me to thinking more about public health. I got a degree in public health, went to the Centers for Disease Control for a couple of years in a training program, thinking I'd stay 2 years, stayed 20. As I realized how important some of the work that CDC was doing. But I got very involved, as was mentioned in the introduction, in the HIV epidemic. And for anybody who's been involved with HIV, yes, it is an infectious disease. Anybody can get it, but at the end of the day, it is not randomly distributed. And in some ways, HIV, like so many other illnesses that we have, really show our societal fault lines, because people who were disproportionately impacted by HIV were often poor, discriminated against because of sexual orientation, people of color, etc. So people who were poor or marginalized, stigmatized, were more likely. And so, looking at some of these societal issues in this country that were all about inequity, I started getting very involved also in the global HIV epidemic. Okay. And some of those same sort of societal factors are what undergirds the risk for HIV globally, just like it does here. And as I kept searching for, how do you not look just at Band-Aids and short, quick fixes, but how do you actually look at the underlying root causes? I got much more engaged in looking not just at health, because in the health box, in the health toolkit, you can only do but so much. But if you really want to have an impact on health and health inequity, whether it's HIV or anything else, you've got to look at housing, you have to look at transportation, education, economic opportunities. And so those were the very things that led me to CARE, where we worked in 80-some countries around the world with some of the poorest communities, looking at how do you develop long-term strategies to address these root causes of poverty. So, you know, I had kind of gone from individual medicine to looking at population medicine and population health to thinking about what were the underlying causes that led to inequities in health, both in this country and then around the world. And I think for me, you know, again, we think about our lives in stages. What brought me into a lot of what I was doing to the very beginning was the inequities that we have here in this country. Growing up as an African-American woman in the 60s, early 70s, you know, I saw a lot of things that were very troubling and disturbing. And the minister talked about the anniversary of Martin Luther King's assassination. I was a young teenager at that time, and I saw the kinds of things that happened to cities and saw the bleak despair that so many communities face. And so, you know, that was where I started. And when I had this opportunity to think about coming to a city like Chicago that has real entrenched challenges, but also one of the most engaged civic communities that I've ever seen in any of the cities I've been in, where I think there's an incredible love of this city, there's an incredible sense of goodwill and wanting to do things. So I thought the combination of this venerable organization, 102 years old, well trusted, relatively well endowed, with this city that has incredible goodwill and a reach in neighborhoods and experience in neighborhoods where there's been huge disinvestment, that I thought that was a potential for doing some really important things. And I also, having spent so much of my time globally, so much of my career globally, this last few years has also shaken me a lot. What's happening here in our own country? And I think that we're at risk as a nation of losing the role that America has played in the world. And that if we don't get our own house straight, I think we're going to have some real challenges for our place in the world and the important place that America plays for the rest of the world. So I think by getting our own house in order, we're not only doing it for ourselves, but I think we're doing it for the world. And I think the moral authority that America has always had has to be rebuilt. And some of that is around how do we address some of these intractable, what seemingly intractable inequities that exist here and in other places around the country.
You mentioned the challenges.
Long answer to you.
Well, no, that's okay. See, we're not on television, so I don't get the rap from my producer in my ear, which is what we usually get. But you mentioned the challenges that our city faces in our country. I know you had said when you first came here that you have no concrete plans or a set of plans when it comes to the direction of the trust. You've been here for about 6 months now. You've been sort of on a listening tour with the donors and the grantees. What are you hearing about the challenges that we are facing going forward as a city?
Yeah, and let me just say, I did have ideas. But what I didn't want to do as somebody who was coming into a new city and a new organization, come in with my own agenda. I wanted that to be informed by the people who were closest to the issues, for the people who know this city better, to the incredible staff that I have the honor and pleasure of working with who really know communities. And so I wanted my thinking to be informed, and I thought that it was a good opportunity with a new leader for us as an organization to step back and to really think about where can this organization that, again, has all these incredible assets really make a bigger difference. And I think, like so many organizations that have, we're a community foundation. We exist to serve the Chicago region and to be a good partner. But I think, as in so many organizations, it's easy to become all things to all people. Yeah. And I could read a list of the incredible things that this organization has done. And yes, it has done many things. But I think there's an opportunity to actually be more focused about what we do and perhaps have longer, more sustainable impact on a few things and do those well. So, I have been listening and learning. I spent a lot of my first 6 months just talking to lots of people. There are a lot of people in this room who I've had conversations with to get people's perspectives. I'm now doing a lot more of getting out and seeing things on the ground. I want to really see what are people who are living the experiences on a day-to-day basis of grinding poverty, of lack of resources, of inadequate education. What are they saying about it, and what are their concerns? And I think, we come back to, and one of the forums we have is On the Table, and many of you have probably been involved with On the Table. We'll be doing that in another month. Year after year, we talk broadly to a broad range of communities, and we get a lot of the same answers back. People are concerned about public safety. They're concerned about getting jobs, they're concerned about education, and they're concerned about the racial tension that exists in this city and the extreme segregation. And so, I think there's a whole range of issues that we could focus on, or we could step back and say, if we want to have an impact on something, what are the integrated set of activities that make a difference to be able to move the needle on something. So to be concrete. So for example, it's widely known that if you go 5 miles in any direction from the loop, you can get a 15 to 20 year gap in life expectancy. So if you live in the loop, if you live in northern part of the city, your life expectancy is somewhere between 85, 87. But if you go 5 miles away in some of the poor, disinvested communities, your life expectancy is closer to 65, 67. So, in this city, like so many, but particularly the city, zip code is destiny. And if you want to have an impact on that health gap, it's not going to be just because you get people in to see doctors more often. It's going to be because you have grocery stores that sell a high quality of food. It's going to be that you have access to education, transportation that allows you to get to a job and keep a job. It is whether or not your streets are safe to walk down. So, I think any issue that we take means that we'll have to enter it in a variety of different ways. So that's kind of what I think we will be looking at. Where are there some things where there's not exactly white space, but where we as the Chicago Community Trust and the assets that we have as a funder, as a convener, as a trusted voice, in the community, where can we put those assets to best use, and how can we do that in a way that really understands how people live their lives, because we don't live our lives in sectors.
And it's interesting, Dr. Gayle mentioned, and that was an insightful study about the gap in the life expectancy. If you all are interested, you should look it up, because oftentimes when we first hear those numbers, we think, well, violence is the reason. And when you look at it, that's not the only reason.
That's not the only reason. Yeah. It's a reason, and we know it's still the leading cause of death for African American and Latino young men in the adolescent and early age group age range, but it's not the reason for the gap, and it's that whole broad range of other things.
I have to ask you about just the core mission of the Chicago Community Trust. Perhaps all of you in this room understand what the Trust does, but by and large, a lot of people, when you do news stories about the Trust, when I first came back to Chicago, so I went from Chinatown to Rogers Park to Morton Grove, went to U of I. When I came back to take this job at Channel 7 16 years ago now, and I first did a story about the Trust, I had no idea about the reach of the Trust. Do you find that still today, that the community still kind of doesn't completely grasp what the Trust does?
Yeah, I think that's fair. It's part of why I think we want to be more focused so that we're able to tell our story better, not for the sake of telling a story, but because I think it does help to focus your efforts and focus who you partner with and how you operate. But the Trust is different things to different people. For many people, it is where they are able to express their philanthropy. We have over 1,000, about 1,500 donor-advised funds where people are able to work with the trust to express their philanthropic desires. We also serve as a grantee, and particularly a grantee for the nonprofit sector. One of the things that we try to do is to build a strong, healthy nonprofit sector, because we know that those, particularly the community-based organizations, are really important resources for communities. They provide services, but they do more than provide services. They are anchor institutions in many ways in those communities. So we are a grantor. We also raise funds. We work with donors. We hope that we're a good source for people who are interested in making a difference here in Chicago. Think of us as the place where they can get good advice about where can their resources best be used. So, you know, as I said, we're also a convener. We also do a lot in the area of civic engagement through things like On the Table and other activities. So we are a lot of things. And I think that's, again, part of the reason why we're so excited about bringing this all together in a way that can be perhaps more focused, and we can tell our story in perhaps an even more coherent way with the ability to talk about our impact very clearly.
And you do have tremendous impact. I was reading, I think last year alone, the trust granted out funds to 11,000 nonprofits
Right.
in the city and the suburbs. I mean, that's a phenomenal number.
It is, and I think it speaks to the fact that those organizations are so important to the civic life of this community.
I got to ask you also, as we go forward and you have clearly a wonderful working relationship with your existing donors, longtime major donors. As you look forward to that next generation of inspiring them for civic engagement and philanthropy, how do we enter that space and make that work?
Yeah, and it's a great question, because today's or the next generation of philanthropists are not necessarily the same as today's generation, and we do a lot with young professional advisors, for instance, who are working with younger clients. But one of the best examples is our collaboration with the Searle family. The Searle family, people know Searle Pharmaceutical, John Searle, who started the pharmaceutical company, and that family was and still is one of the most important contributors and donors to the trust. And we've now worked with multiple generations of that family. And I think we have the Kinship Foundation that works with the Searle family, is represented here by Renee Michael. It's a wonderful collaboration, and it's the way in which I think we want to do more of our philanthropy. This is not here's money, this is what we want to do with it. Let's talk about this together. Let's co-create programs. So we have this wonderful program that we're doing with the Searle family called Food Land Opportunity, that really looks at the fact that we have this high demand for agricultural products here, but we're not really utilizing local production. And so it's a way of really looking at there's a demand, and how do we actually look at that supply so that we're making sure that more local and regional production goes to serve the demand of people here in this region. So I think it's been a wonderful collaboration, and now we're working with the next generation of the Searle family, who are incredibly excited about continuing this legacy that has been so long with the Searle family and the trust. And I could give other examples, but that's perhaps the best one because it's one of the longest collaborations we've had, and it's been fabulous.
You've also had an experience, I know, the last few months to tour some of the nonprofits that you have granted funds out to. Anything that stands out in your mind right now?
Well, because I was just there, the two that stand out in my mind, it's actually from a project called Benefit Chicago, and people may have heard of Benefit Chicago. It's a new way that we're doing work. This is impact investing. So we're actually giving loans, not grants, to organizations who might be a bit higher risk, who might not be able to qualify for traditional capital. And so we're giving loans, $500,000 and above, to businesses that are able to show that they've got a good and strong business plan and also a social mission. So the two that I just went to, and Will Towns here is the executive director of Benefit Chicago, so it's on my mind. We went to one called Sweet Beginnings. And
on that.
yeah, wonderful, wonderful organization that is teaching primarily people who have been in the criminal justice system how to grow bees and then to make honey that is sold, a very high grade of raw, unprocessed honey, and then also to use honey in beauty products. So there's body lotions and body scrubs and, and these are now, you can go into Mariano's and Whole Foods and buy these. And to go there and see these, and the program is fabulous because it's part of a broader program, the North Lawndale Employment Network, where they are able to take people who are re-entering and give them skills. And there, I think, if I remember the statistics correctly, where recidivism is about 55% in Illinois, they have a less than 4% recidivism rate because of these programs. Yeah.
Wow.
And when you talk to somebody who has the dignity that having a job does for them, and that they can then go to a Mariano's and see their produce on the shelf. I mean, it doesn't get much better than that. The other one was Garfield Produce, which also an incredible story of a couple who were very dedicated to doing what they could in the Garfield area, getting jobs, and again, oftentimes people who are hard to employ because of criminal backgrounds. And they decided, they were thinking of a lot of things, but decided to do urban farming and found an incredible young man who is the manager, and the loan that we were able to give them was used to upgrade their facility because they had a pretty old facility that wasn't production grade level. And they're now going to be producing, I think he told me something like 100 pounds of microgreens a week, which will allow them to now send that. And I think if I remember the numbers right, it was something like on the order of $250,000 of sales in revenue. That's not net, but still, I mean, a really thriving business, urban farming, and they're, again, employing people who would have otherwise been close to unemployable. And so those are the kinds of stories, and to be able to give loans and the rigor with which they have developed their business plans so that you know that this is going to be a sustainable business. It's pretty impressive. And to your point about the next generation philanthropists, part of the reason we're so excited about impact investing is that that's an area that a lot more young people, they're really interested in, first in impact, but they're also interested in not just giving grants and keeping people in this grant cycle, but how do you actually help people build businesses that then lead to a sustainable, a much more sustainable business model where you're not having to constantly write grants. And it adds a different dignity when you're talking about actually creating jobs as well. So doesn't get much better than that.
That Sweet Beginnings, if you guys have not tried that honey, Dr. Gayle is right, it is really good. You ought to look for it.
The honey is good, the lotion is great, the body scrub, all of it.
Check it out.
Anybody need presents for their wives or their husbands or whoever, Anyway, it's great.
You're right, the dignity part you can't beat. We've done stories on Sweet Beginnings, and when you see it in their faces, that their products and what they have worked so hard for, something that they never thought could be possible, maybe a few months earlier, now they're doing it. That brings us sort of to On the Table. That is something I hope all of you participate in, but when we first heard about it, what a phenomenal concept. Just tell us a little bit more about that. You're about to launch into it again. How has those conversations, do you think, changed the trust and what the trust, is going to do?
Yeah, so I'm going to participate in my first On the Table this year. This is the 5th year, and I'm really, really looking forward to it because, what I hear from people is that having this day that is dedicated to having essentially tough conversations allows people to have conversations that they might not have had otherwise. And it gives communities that had not necessarily interacted with each other the opportunity to interact and open up subjects that are difficult. And out of it, this year we really want to put a big focus on action and doing and taking action. It's been great to have the conversations, and I think in any time social change, you got to start with people talking openly and honestly about issues. But there's a point at which talk doesn't necessarily keep you moving towards action. So this, we're going to put a big focus this year on doing, trying to support people in their efforts to actually come out with tangible, concrete actions, and hopefully be able to come out of that with a set of some maybe really creative, innovative ways in which people can practice social change in their communities.
I got to ask you something. We mentioned in the introduction that Dr. Gayle was named by Forbes magazine as one of the 100 most powerful women. But I hope all of you also know that in the Trust's 102-year history, she now is the first woman to lead the Trust. I'm sure everybody wants to know, I know I want to know, did that factor at all into your decision to come here to take this job? What did you think when you knew that you were going to be the first woman to lead this position?
Well, more than that, I'm the first woman to lead in 102 years, and when I divided up 7 by 102 and knew what age I was, I'm like, oh, I hope they don't expect me for 25 years. But no, I've been the first. I look forward to the day when being a woman or being African American is not that unusual, that it is not a first. That said, I take it very seriously. I think that I am a product of who I am and how the world has interacted with me, and I think that it is important that I bring my whole self to the job. Part of that is being a woman. I think it's also important that for young women and little girls that they can look up and see somebody that looks like them, and that gives them more hope and courage and sense of what the possible is. So I think it's important, and I don't treat it lightly.
Well, we are glad you are here. But before we wrap up here, we do have a beautiful video that we want to share with everybody about On the Table that we talked about. So take a look at this video. We'll come back with some questions.
Ideas can come from anywhere. Next to salads, on the other side of coffee cups, in restaurants, kitchens, dining rooms, and boardrooms. It doesn't matter where the idea comes from or who it comes from. What matters is what are you gonna do with it? On the Table. Be a host or a guest. Then move ideas from tables to communities. Take action. Change something. Meet, share, do. Put your good ideas into action.
And that truly is what it's all about, putting it all into action and encouraging that next generation to get involved. Well, hello there.
Hi, Judy. Dr. Gayle. Wasn't this terrific? Let's give him a big round of applause. So we have time for some questions. So if anybody has any questions, the members of our staff will come by. I see someone holding up a blue card over there. Just bring them up here. We'll try to answer as many of these questions as possible. With regard to open tables, we've been part of that, the City Club, for several years. We've had the breakfast, and we've had this room filled with people who are creative and energetic and hopefully have produced some action results, as you indicated, and we'll be having another round of open table later this spring.
On the table, on the table.
On the table, sorry.
Open table, that's when you have to
Make the reservations. Yes.
Yeah.
Okay. Now, this is from one of our sponsors. of today's luncheon, Jackie Davidoff. Anger can be an important driver of action. What are you most angry about in Chicago? And how and where does the Trust's mission compel action?
Well, I hope our mission, which is to, broadly speaking, make the Chicago region vibrant, productive, and prosperous. I hope that overall that spurs us to action. But I guess when I think about what I'm the most angry about, I spent Saturday doing a tour of the South Side, and earlier in the week I was on the West Side, and earlier in the week before that in Little Village, and I live downtown. I'm 2 blocks from my office, keeping it real simple, and I'm in this incredible, beautiful city with gleaming buildings. And what I'm incredibly angry about is that when I go to some of these neighborhoods that still, after 50 years, still look like bombed out communities where there's been a total lack of disinvestment and a total lack of compassion for many of the citizens who live in those parts of town. I just think that kind of gross neglect, lack of development, lack of investment is just unacceptable. And so it's hard for me to realize, and again, I think back, it's 50 years since the Kerner report was first put out, and there was a report from I think one of the remaining commissioners from that report, Fred Harris, who wrote a book basically saying, nothing has changed in that 50 years since the Kerner report, which said we're moving to 2 societies, one white, one black, separate but unequal. And, to look up 50 years and see that that's still the case. Now I guess in Chicago would say there's tale of 3 cities if you think of the Latino population, but it's just unexcusable. And so, I think I don't want to, well, I probably won't wake up 50 years from now, but, I don't want the legacy to be that 50 years from now, we're saying the same thing in this city, in Chicago, or any other place in the country.
Thank you. By the way, the book that Dr. Gayle just mentioned by former U.S. Senator Fred Harris, a Native American senator from Oklahoma, I'm about halfway through it. It's really a very interesting read. It's something you might want to consider picking up.
Yeah, Healing the Divide, I think it's called.
Okay, this question is from Susan Malik McKenna. Susan, where are you? City Club member, right? Former commissioner in the city of Chicago. She believes in human potential and assets. The question is, what do you see as our civic community's responsibility in supporting healthy, successful reinsertion of our incarcerated populations?
Yeah, and I'm sure there are many, many people here who know a lot more about the criminal justice system here and what are some of the best policy remedies. I think first and foremost, it's always, I think it starts with caring. Second, it starts with knowing, being aware of what can be done, and then doing. And so I think it's clearly a huge issue, and one where there's lots of clear sense of what some of the policies could be that make a difference. But just as I was talking about the health disparity and the kinds of ways in which you have to think about integrated programs, I don't think there's any one answer or magic bullet. And I think that's probably the thing that I think we get wrong the most is that if it's a criminal justice issue, we think let's only talk to the people in criminal justice and that's where we're going to find the answers. I think it's when we start having more of this crosstalk between people who bring different pieces of the solution to the table, and when we start bringing different sectors. Because I do believe that we've oftentimes let the private sector off the hook too much. I think there's so much that the private industry, businesses are starting to do and can do more. And so I think, we always think social sector issues should only be solved by the nonprofit sector. Well, I think that's putting an undue burden on one sector to solve all the problems. So I think we need government, we need the not-for-profit sector, we need business, and we need everybody working together in a way that brings what they have to the table. And so, it's not as specific about criminal justice, but I do think it's that, how do we get people who bring different pieces of the puzzle together to come up with the really comprehensive solutions?
Thank you. This question is from Pastor Martin. Dr. Gayle, how do you see the very diverse religious communities assisting your vision for the trust?
Yeah, good question. I think that faith communities have such an important role to play, because so much of this is also, how do you change community norms, and how do you change people's ways of thinking about what's right, what's wrong, what's acceptable, what values, because at the core of this is really about values, and how do we value each other, how do we value our communities, and faith communities are the ones who are so much a part of helping to shape our norms and our cultural values. So I would love to think about ways in which we can have perhaps even more engaged relationships with our diverse faith communities. And I think really the diversity of the faith communities here that I think have so much to offer as well.
Thank you. This question is from Calvin Holmes with the Chicago Community Loan Fund. Calvin, where are you? Way in the back, okay. I see you're not a member. You become a member, I promise to move you up. I'm a Chicago Bears season ticket holder. It took me 51 years to get from the south end zone to the 40-yard line. So Rome wasn't built in a day, Calvin. Give us a chance. The question is, your point about America needing to reestablish its moral authority in order to lead the world in reducing social inequities is well taken. Can U.S. civil society rebuild our standing in the world without consistent leadership from the White House?
Oh.
Remember, this is the City Club. We allow sandbagging.
Part of why I was so excited about coming and working at the local level in a community, in a city, is that I think that a lot of innovation is going to come from our cities. And I do think that, this is a time where we've got a lot of noise going on at the national level, but I think that's not an excuse for not being able to, where we are, start thinking about what are the kernels of social change that can actually make a difference, but that can be a ripple effect for the whole nation. So I think, in times where there's perhaps not the kind of leadership that we might want at the national level, I think that's the time when we take the leadership here and really come up with real, tangible, creative solutions.
Thank you. I have two last questions, Dr. Gayle. This is from Lance Russell, who's with the Chicago Technical or Technological Academy. Where are you, Mr. Russell? Okay. Foundations have directed most of their educational support towards quote-unquote scalable programs that push into schools. Do you think the Trust can do more to directly sponsor schools, such as sponsor a school approach?
It's an approach some have taken. I'm not sure that, whether we'll go to a sponsor a school approach. There's lots of ways of trying to create change. One is that you double down and be very intensive in a few areas. Others are you take a broader approach to scaling things that work. Again, we're in kind of a discovery phase where we're going to step back and think about, given who we are, what's the best way to do it. But I think there are some of these things where there is no wrong way. It's just what's the way that makes the biggest sense for your particular organization.
Okay, and our final question, and then we'll get to our drawing and a few last remarks. This is from Ellie Foreman with Mesereau Financial. Ellie, where are you? Right down there. Great, thank you. This is not to get political. Everything's political, okay? What's your personal pet project? If you could write a philanthropic check to one nonprofit or to benefit one issue, what would it be and why? Everybody's going, me, 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 me.
I know, right? Yeah, I don't know that I have a pet project. I'm still kind of scoping out the landscape. I will say, as I mentioned before, I really do think some of these innovative approaches, particularly things that are building businesses like the ones I mentioned, where we're actually investing capital, helping people start businesses, have a lot of resonance, because when I was at CARE, we did a lot of work with social enterprises and saw that you can take things that used to be grant funded that had a short life and would never be able to have the kind of long-term impact that's necessary. And if you can transfer those into actually being businesses, they're more sustainable. You're bringing in capital that then allows you to continue to improve, to enhance your business and grow your business. So I think that approach generally is a really good one. I also loved seeing my colleague Tony Urban there, and Gary Slutkin was here earlier. I think some of the work around violence that takes a different approach, the healing hurt people, which is a trauma-informed approach that really looks at young people coming into trauma centers and then really thinking about a much more holistic way of looking not just at their physical, but also their emotional, their psychological. These are young people who have gone through tremendous stress and PTSD, and are we paying attention to the whole person in a way, or the Cure Violence approach that really looks at public health, a public health approach to violence, and takes it, looks at some of the very things that myself and Gary used to do when we were in HIV, where you look at the high-risk populations, take an epidemiologic approach, look at what the cultural norms are, look at who's at highest risk, and really concentrate your efforts there. So I think, for me, it's not a particular project. It's how are we thinking about approaches that are innovative, that are much more integrated, and that are not designed just to put on Band-Aids, but are really thinking about how do you create and sustain change over a long time. Because the reason why a lot of these things haven't changed is because they are long-term problems, but we're trying to address them with short-term interventions. So I think we've got to have our interventions be commensurate with the problems. So those are the kinds of things, and there's no one pet project or one check that I'll write. Since that's the last question, let me just close by saying, first of all, Chicago has been the most welcoming city I have ever come to. And I just want to thank so many of you who are here in the audience and others who I have met who have extended such an incredibly warm welcome to me and to my husband, who's returning after having not lived here in 40 years. By the way, if anybody needs a gently used pediatrician, he's still trying to settle into work here. So I also, just want, as the head of an organization, you oftentimes get an incredible amount of congratulations for work that is built on the backs of so many people. I saw earlier one of my predecessors, Don Stewart, who was he and his his wife Isabel, who have been friends. We were both in Atlanta over different times. My incredible staff. I walked into a office where people didn't know who the new leader was going to be. They have welcomed me so graciously. It's an incredible staff. It's probably the most diverse and inclusive staff that I've ever worked with, so it is a real privilege for me to work with those staff. And then finally, my executive committee or our board, who had enough faith in me to bring me on and have been incredibly supportive all along this last 6 months journey. So, thank you, Chicago.
Welcome. So someone just gave me one last question. It's about your husband. Does he accept Medicare?
He's on it.
Okay.